What's going on, everyone? Happy Tuesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Tuesday edition of the Pandemic Update for Tuesday, September 24th, 2024. If you're new to my channel, welcome to my channel. This is where I do the daily pandemic update. You may be asking, what's the daily pandemic update? Well, we talk about all things COVID, any other virus that could be a health threat to you, pollen levels, air quality levels, COVID and wastewater, EMS data, people who test positive for COVID, famous people, of course, who test positive for COVID. All this to try and keep you safe and healthy from these different viruses and informed of what's going on. Because, guess what? The media, the governments of different countries all around the world have stopped talking about this. You hardly ever hear about this. I mean, the government has really dropped the ball. Just yesterday, I talked about how free COVID testing was supposed to be available. Again, you can order test kits here in the United States. As of today, man, it's still not a thing. It was supposed to happen yesterday. There were issues on the website. I've seen no update. I mean, it's just totally ridiculous that we do not take this serious. And meanwhile, people still test positive, go on to develop long COVID, get hospitalized, and even die of COVID. And it's something that we're going to be dealing with for a long time. Want to stay informed with all this? Subscribe down below. Give this video a thumbs up. The more people that give it a thumbs up, the more YouTube's going to push this throughout the algorithm. Let's try for 150 to 200 like button hits today. Of course, share this video with anyone you know. Hit the notification bell to be notified when I do my latest updates. And leave your comments down below. Alright, we have a pretty busy news day today. I think it's going to probably be one of those videos that are closer to 20 minutes. We have a couple things that we missed on, including the new update from New Zealand. But starting off with this, in Ireland, Health Minister Mike Nesbitt has tested positive for COVID, days before he is due to be the new UUP leader. So it looks like he was going to take a new position, and well, now he has tested positive for COVID. In New Zealand, they report their COVID-19 update as 1,012 new cases with 2 further deaths. But something interesting here that you're going to see in a minute. 641 were reinfections, 52 people in the hospital with non-India intensive care unit. I don't know why they ever don't report anyone in the ICU, but yet still have deaths. I don't know what it means to get into the ICU over in New Zealand, but clearly, for whatever reason, I've noticed they never ever report someone in the ICU. Very rare if they do. Alright, in California, 17 dairy herds now infected with H5N1 bird flu. Nationally, officials have announced 218 outbreaks across 18 states in the last 30 days. However, California has accounted for all but 2 of the latest outbreaks. This coming from Corona Heads Up, and he got this from the Los Angeles Times. Alright, Pope Francis, yet again, I mean, this has happened quite a few times, has taken ill. He was supposed to be going to Belgium and Luxembourg, and the trip is still going to happen, but he had to cancel his appearances on Monday because of, quote, flu-like symptoms, minor flu-like illness. I mean, we have seen the Pope get sick time and time again, and it says right here, slight flu-like state, whatever that is supposed to mean. So, hopefully the Pope feels better. God bless the Pope. Alright, moving on now to our next story, and this is a study. We have a couple studies today. ASU study, students not close to recovering academically after COVID-19. Can be several reasons for that. One, remember homeschooling, virtual learning back in the early days of the pandemic. That was a thing that really messed things up, and kids fall behind because of that. But number 2, infection itself, COVID, it can go on to cause some problems. It can cause brain fog, it can cause fatigue. Those are 2 major things right there that can cause issues when someone is trying to get an education at any level: kindergarten, elementary grades, middle school grades, high school, and even going on to higher education such as the college level. It can cause problem. Alrighty, speaking of brain fog, well, study sheds new light on severe COVID long-term brain impacts. One of the most striking findings was the post-COVID deficits in hospitalized patients look similar to 20 years of normal aging. That's not good. There's an easy way to prevent that. Avoid catching COVID. And unfortunately, at this point, most people can probably say they have had COVID, which is not a good thing. And speaking of that, just out of precaution, because, I've had some risky activity. I had a dentist appointment yesterday. I've had some other things happen lately. I took a test today. Take a look. Now, this is Abbott, and it did come up negative, and it was reminding me when I took this Abbott test, I have an archive over on my website, datareport.info, and it reminded me of someone I need to add to the archive, and that is Jim Cramer. You may or may not know who he is. He is a financial contributor. He has his own show over on CNBC. He's been on there for a very long time, but when I looked at this Abbott COVID test, it reminded me of when he had COVID just a few years ago, and he showed 3 of these. He joked and said, "Oh, I have 3 of a kind. Yeah, I have it. I have COVID." And he says, "I've come to work a lot sicker than this, yada, yada, yada." The point I'm trying to make here, this is a good reminder. COVID impacts everyone different. Some people are asymptomatic. Some people have minor symptoms. Some people have moderate symptoms. Some people get it randomly severe, even if you're not immunocompromised or high risk, and end up in the hospital. It just happens. It impacts everyone differently. If you want to look that video up, it's out there. It's on YouTube when Jim Cramer had COVID. So he will make the archive, as will these other ones that I need to add. Yes, we have to be fair and add Trump to the website as well, because, well, I just did Kamala Harris's case last night. Alright, moving on. Getting back to today's news, we do have just a couple more things in the news category for today. And the next thing that we have to talk about is Mike Horger and his PMC COVID-19 forecasting model. We're not going to read through the whole thing. I'm just going to show you briefly. We're not going to go through the whole thread. That would take too long. But here's basically what his model is forecasting. The U.S. continues to see an estimated 1.1 million daily COVID infections, with 2.2% of the population actively infectious. As we descend from the peak of a 9th COVID wave, transmission will remain very high the rest of 2024. And you can see here on his model, the purple being the projection, you can see it's going to continue to drop, and at some point, it's not showing it here, but at some point, as we approach the holidays, we all know there's going to be that winter surge that comes around the holidays. And it says, looking at year-over-year graph, note that we're in uncharted territory for this point in the fall. Expect a very high lull in early November before the winter surge sets in. As we have noted previously, his current estimates are likely slightly underestimates given elevated school-based transmission and CDC data standardization process. And you can see here on this chart that we are in uncharted territory for the back-to-school season. Things are still very high at this time, which is not a good thing. And you can see here it is expected to drop through November. All right, moving on. If you want to see this full thread itself, I did retweet it, and I think I will be doing a thread today for today's update on my site, just because, yeah, there's quite a few things that we shared here. I just wanted to run through this again from yesterday. BNO's weekly report from last week, there were 131,271 new cases in the hospital. That dropped by 325. That was 4,974. In the ICU, 589. All these numbers can significantly be underdone, especially cases and new deaths. There were 1,360 new deaths reported last week, which is just totally ridiculous. Here's my website here, datareport.info. Yes, we did add Vice President Kamala Harris, and eventually Donald Trump's case is going to make it in there as well. We also added Snooki, made it into archives. She had a case of COVID back in, when was this? I actually have to look this up. When was her case? Her case was back on February 14th of 2021. All right, heat-related illnesses. I think we're coming through the final weeks of me showing this, unless another round of heat pops up somewhere. Southwest U.S. is still bad. Mid-South and Texas has quite a few counties. Florida is still bad. And look at Michigan. There's quite a few counties in Michigan that are still showing higher than average calls, and even a couple counties, more than a couple counties in the Northeast, especially New York State. Let's take a look at the pollen levels, which should be improving. 23% of the country is in low to medium status, doing really great in the Great Lakes and the Northeast at this time. South is where there is still problems as the leaves fall from fall foliage in the Northeast. We may see a few more pollen issues. All right, taking a look at today's look at the not allergy levels, the air quality levels. We just did allergy levels, and we can see here there are still some problems in the Southeast. Something going on here in the Carolinas. I don't know what that is. I will be investigating. Perhaps maybe in the mountainous region there are some wildfires. Still some wildfire issues out on the west coast with some yellows, oranges, and reds. But again, I'm really concerned about this in the Carolinas. Take a look at that. Even some purple showing up. That's not good, my friends. Want to learn more about climate and weather? I've been talking about a tropical system in the tropics. More on that over on my Climate Data Report X account. Taking a look at Philadelphia yesterday. Yeah, 870 EMS calls once again. That's a really high number. And speaking of high numbers, take a look at Montgomery County right now. Wow, a lot of calls and a lot of accidents as well. You know, COVID brain can lead to more accidents. Respiratory emergency right now shows up several times. We're seeing in East Norton Township, cardiac arrest at this time. It seems like almost every pandemic update now, I'm showing at least one cardiac arrest call. Look at that. In Ambler, Pennsylvania, cardiac emergency just showed up. Yeah, it's been really busy. And take a look at Chester County, Pennsylvania. Wow, wow, wow. Not one, not two, not three, but 4 sick person calls. We see respiratory emergency. And look what else just popped up. In Phoenixville, Pennsylvania, cardiac arrest is showing up there. It's just new normal that there are so many severe calls anymore. And I was listening to Center County this morning, and prior to doing this update, Center County, Pennsylvania, really busy for calls. I've heard COVID mentioned multiple times, and in fact, I think I'm going to be adding a COVID outbreak to my website, and I'll show you why. Because, well, you can't really see it here, but take a look here. This is Pennsylvania's new update, but as I said, I was listening to Center County this morning, and right here, there is a senior facility, nursing home, called Windy Village, which is in Phillipsburg, Pennsylvania. And at Windy Village, I was hearing calls over the weekend, and I heard a call today for COVID positive people that need to get to the hospital. It's a nursing facility. I think that's calls for me to create a COVID outbreak over on my website. I mean, it is one. It is one. I mean, I've heard multiple calls now for that place, and unfortunately, that's actually where my grandmother was many years ago, but we won't go there. Other grandmother, not the one I took care of. But Pennsylvania in general, we can see up in Scranton area, orange. That means there's an increase for COVID. Chester County, you just saw all those sick person and respiratory calls, all those severe calls. It's increasing there once again for COVID. And we can see up here in Westmoreland and Armstrong County combination at this wastewater facility, it is increasing. Now, I have not gone through every chart here, so there could be some that are hidden, that are not showing up as an increase and are increasing. It is a real issue in Pennsylvania. It happened in Center County, Pennsylvania, where it would show no change or just slight increase. And I look at the chart and say, whoa, wait a second. No, that was a large increase. A few weeks ago, that was an issue. In Monroe County, East Stroudsburg, there is a decrease at this time. In Canada, the viral activity level for COVID is moderate. Flu A, Flu B, and RSV is low at this time. All right, Walgreens. National positivity rate is 25.3% for COVID, and the prior week was 26.2%. Total test, 9,981. The prior week was 10,996. And the positivity rate this week did drop by 0.8%. Let's take a look at some states now. California, 26.4% positivity rate versus 25.9%. That is up by 0.5%. Total testing did drop. 349 versus 379. In Colorado, 24.7% COVID positivity rate versus 26.2%. That is down by 1.5%. Total test, 194 versus 202. In Illinois, the positivity rate is 23.6% versus 28.2%. That is down by 4.6%. Total test, 712 versus 849. Testing did drop. Minnesota, 28.4% versus 26.1%. Difference of up 2.4%. Total test, 176 versus 142. Over in Nebraska, the positivity rate is 22.2% versus 17%. That is up by 5.2%. Total test, 45 versus 53. And over in the state of Maine, the positivity rate is 21.1% versus 30.8%. That's a difference of down 9.7%. Total test, 19 versus 13. And Walgreens on Georgia. The positivity rate is 18.6%. The prior week was 22%. Difference of down 3.4%. 424 tests versus 473. Testing down, positivity rate down. That is a legitimate drop. All right, let's take a look at a little bit of COVID and wastewater. I think we'll just take a look at the national levels for today because we are running short on time. We can see overall things are dropping for COVID. You have this wonky movement. That'll get corrected later in the week. And RSV, also a wonky movement. That should hopefully get corrected later in the week. And influenza A, little wonky movement at the end, but overall, that is starting to rise. Influenza B is low at this time. HMPV is dropping at this time. And norovirus has been starting to trend a little bit higher at this time on the national level. All right, taking a look now at the latest variant of COVID. This should update on Friday. KP.3.1.1 leads the way at 52.7%. XEC does not make the list yet. Will it make it this week? I don't know. We'll find out on Friday. Taking a look at epidemic status, it is growing in New Jersey, likely growing in Massachusetts, and likely growing in Washington, but it's declining, or likely declining, in many states, and I think the largest number on the map that we see here is stable or uncertain of any color. There's a lot of states that are either stable or uncertain at this time. All right, taking a look at New Jersey today, 69 out of 70 hospitals are reporting 434 hospitalizations. That's a good number. It means it's starting to drop. Of course, any number is too high, but hey, it's starting to drop. It did not rise today on a Tuesday. 10 people on a ventilator. In the ICU, 46 at this time. And discharges. There have been 50 discharges reported in the last 24 hours. What's also a good number? New York State. After that little bit of a rise last couple of weeks, it started about 2 weeks ago, got a little more significant last week, they're starting to drop once again. 918 positive tests in the last 24 hours. I'm really happy with that number. Of course, we know it's an undercount. Still probably too high, but hey, it's starting to drop at this time. Taking a look at their hospitalizations, little slight increase today, but it really didn't increase that much, and in fact, I think this could be the week they drop below 1,000 people in the hospital. So the new number is 1,066. In the ICU, 113 at this time, and let's take a look at New York City. Of course, this will refresh on us. That's fine. We like it to be up to date. And taking a look at what's happening in New York City, you can see not much of a change from the previous update. It was 284 the last update. It actually dropped even more on a Tuesday. Good news. 279, and number in the ICU is 33. And let's also take a look at Western New York, because remember last week that was rising. Well, now that's dropped some. 65 people in the hospital and 9 people in the ICU. All right, real quickly here, let's go over to Virginia. I believe I already refreshed this. Yes, I did. And as of the 21st in Virginia, emergency department visits diagnosed with COVID was 1.60%. You can see here, even if I change this to show the, well, let's show it. Yeah, let's change this to show the counts, and you'll get the idea here. This number is significantly dropping at this time. You can see here, the total number of diagnosed visits is 1,278 for the emergency department, and that should also include, nope, let's change that. We wanted to show urgent care as well. Okay, there we go. Urgent care, 2,610, and that is much lower than the peak, which was in the 5,000. So this number is really starting to drop. Influenza, ever so slight increase. Actually, matter of fact, this week looks to be slightly down. So not seeing that seasonal increase for influenza just yet. Alrighty, folks, that does it for the Tuesday edition of the Pandemic Update. We'll have another update again tomorrow. If you enjoyed this update, give it a thumbs up. Hit that subscribe button down below. Hit the notification bell. Share this video far and wide with anyone you know through social media. Any way you can. Word of mouth works as well. And of course, leave your comments down below. I'm sure there'll be plenty of comments, and I will be around to approve those comments and respond to your lovely comments this evening. Alrighty, folks, thanks for watching. I'll see you all again next time. Have a fantastic Tuesday evening.